Hello, my name is Caroline Poole. Very proud to be a speech and language therapist and be with you today as part of this series towards diversity and inclusion. I'm going to be talking to you today about a methodology that you might want to adopt. We're going to be on for about 10 or 15 minutes today, and I would suggest you let the presentation run through, but then come back to it, break it down in chunks, because there's a lot of content and there'll be a lot more digging that you'll want to do. So I'm not going to be talking to you today about the why and the what, because I think the programme that you've been on will have taught you a lot about what we can gain and actually the urgency with which we need to shift our thinking and our inclusion agenda. I'm going to be talking to you much more about the how. That's going to be what it is today. I'm going to introduce you to a simple framework that you might want to use about making your own improvements. And I'm guessing that you will have been reflecting on your own work environments to date, from a colleague point of view, your staffing, and also about service users, how you deliver your services to make sure they are inclusive. We're not going to touch on that today. I'm going to use some other examples as we go. Thank you. So this is a simple framework that I'm going to talk you through today. It's based on the Institute of Healthcare Improvement's model for improvement. There are lots of models for improvement that you could use, but I find this one really simple, really accessible. There's no rocket science in here, and it's just a very structured way to order your thinking and your activities so that you get the best bang for your buck for your efforts. Okay, so the first thing we're going to do is think about actually what is the problem. You need to dig a little bit deeper on this, because sometimes when we initially look at a problem, it might look like one thing. When we start digging, it actually reminds us that it's something actually quite different. While we're doing this step of the processes, this is a really important part to work in co-production with people with lived experience, be that your staff members, be that your families, your service users, your children and young people. Really important to understand the problem from other perspectives. I think that we've all got a different lens on the world, and if you want to get to the root of the problem, you're not going to do that by projecting your own perceptions onto others. So really important to do some co-production. Once you've had a think about what your problem is and you've been able to quantify it and describe it in a much better way, you need to think also about the scale of this problem. How big is it? And I'm going to just introduce you to the importance of measurement here. We'll talk about this as we go through. We do have a tendency to overfocus on the exceptions. So we think when things happen that are really difficult for us, we imagine that they're happening all the time. That's kind of an overfocus. So drilling down to the actual numbers is really important, because it may tell us quite a different story. What's your baseline? What does the world look like today and at the moment? Okay, so really important here to consider thinking, just back one, normal variation. So I just want to use a really live example around coronavirus of normal variation. So if you think about Mondays, you could imagine that if you only ever took your measurements on Mondays, it's brilliant, isn't it? We have very few deaths, but actually that's an anomaly in the way we report things. So what happens when you get the news articles is there's a 7-day rolling average that tells you a little bit more realistically a picture of actually how deaths are rising or decreasing nationally. So it's important to just look at what is normal variation so we can discount the blips and understand the reality of whether we're moving in the right direction or whether we're moving in a direction that isn't what we would intend. And I think it's really important to think about capturing your data over time. So another great example of this, if we compared coronavirus infections from March 2020 and March 2021, it would tell us absolutely nothing about the year that we've lived. But we often do that, don't we? In our staffing numbers, in our waiting lists, in our referral rates. We use a month last year and a month this year. Actually, it's a really invalid way of understanding actually your peaks and your troughs and understanding the reality of your opportunities for change. Thank you. So once you've done that and you've thought about, we've got a problem, we know how big it is, we know how hairy and thorny it is, what is your ambition? So it's really easy to say we'd like to improve X. as a really bland sentence. And many of our aims do look like that. But what I would challenge you to do is think about having a SMART aim. So unless you've got a really clear goal, it's so easy to drift into the wrong direction, to lose heart, to lose energy, and not be really clear about what is your clear goal. Once you know what your baseline is, I want you to think about challenging yourselves to set yourself a really ambitious but achievable target. So what do you want to achieve? By how much and by when? So as an example, if you want your workforce to represent your community, you've got really clear data about your workforce, your current status quo, and you will have really clear evidence around your community. So you can set yourself an ambition. It may feel daunting, but actually, if you know that that's where you're heading, don't be afraid to set yourself bravery and put your cards on the table about what you want to collectively achieve. It will make a difference. Thank you. There'll be so many things that you could do. And, you know, this is another great way of capturing ideas from a really wide range of audiences. What are the things that might make a difference? Post-it notes, workshops, you know, even in this digital world, we can use digital creativity to gather those kind of insights and thoughts. Really helpful to listen to a wide range of ideas. Sometimes they might seem a bit bonkers in the first pass. Don't ignore anything. Everything has value and everything has a contribution. So then really helpful to map your interventions, potential interventions. You might have a long list of 50 things that you might do, 20 things that you might do, but you want to have a bit of an organized process to think about what you might do and in what order you might want to start doing these things. I think we have a tendency in health to come up with 10 ideas and crack on with them all. And then when we have a success or a failure, we're not quite sure which one of those changes was the thing that made the difference. So we could end up burdening ourselves with lots of interventions that actually add no value or detract from the value. And actually, if we do things one at a time in a sequential way, then we can really spot the difference of the things that made us, gave us the value that we were seeking. So you'll definitely want to spend your time, if you look at this grid, in the high impact, in the green box. But you might want to think about, you know, what are some of our quick wins that are not going to take us much effort. Really important because it builds momentum. It builds belief that you can do something different. It will give you energy and it will sustain you. And I would suggest that you always have some low effort activities running alongside things that actually may be more challenging and take you longer to achieve, because it will keep you all as a group of staff moving forward towards your overall ambition. Thank you. So I know many of you will have already come across driver diagrams, but they're a really brilliant tool for being able to kind of bring down onto a single page a really complex, thorny set of change programs. So the example that I've given you here is from antibiotic prescribing. So there's a clear aim here. What do we want to do? Reduce prescribing to the national average. That's a figure, data set within 6 months. So very clear ambition. And the people that have created this have thought there are two buckets of things that we need to do to make that happen. We need to think about unnecessary antibiotic prescribing, so working with clinical teams and having a program around that. But we also want to work with our populations and our communities, helping them to be able to self-care for minor illnesses. And you can see then that there are a number of secondary drivers, and there'll be a range of interventions that actually might need to be undertaken to push on the primary drivers to build us towards the overall goal. When you're thinking about inclusion and diversity, you may have 20 change ideas that you want to take forward. That can seem daunting, but actually mapping them onto a driver diagram can help you to see where you're taking chunks of activity and making chunks of improvement, but also recognizing that you've a way to go and that some of these other interventions will also be required for you to achieve your overall ambition. I think that helps you to keep it real. And it helps you not to be over ambitious that your one change is going to solve all your problems. Hugely unlikely in this complex area. There will be a range of interventions that you'll want to take. So I'll give you some resources at the end of this slide deck, and you can download some of these tools to help you. But I would really think about mapping onto a driver diagram. Okay, next we're going to think about what does success look like? And again, this is the simple framework that I'd like to offer you that's really important to think about when you make your change idea happen. Where are you hoping that you're going to see benefits? And there are a range of things that you might want to consider here. Patient experience, absolutely critical, I think. So no matter whether you're focusing on a staff intervention or a service delivery intervention, I would always recommend that you think about what differences is going to make to patient experience and how will we be able to capture that. Staff experience is a really important one. So we know when staff are engaged and motivated with a way of working, it sticks. We know if there's great resistance to that, then eventually we will find workarounds to lose that change. So in order to understand staff experience in your change, you need to think about how you're going to capture that. What are the signs that staff are embracing this change? What are the signs that you've got some bumps in the road? You need to pay attention to that. Service efficiency. So efficiency sometimes feels like a dirty word, but actually we all want to drive towards a more efficient way of delivering our services so we can do the best work for the most people in the quickest way. We don't want waits and we don't want people having to delay their access to our expertise. So when you're making those changes, actually, is there something that you won't do and that will make your service slicker? And what might that look like in this sphere? Environmental sustainability. We're starting to talk much more about this because this is another byproduct to some of your changes. So it may be, I'll give you an example of this. If you start to use digital tools, then actually you may be able to map a service efficiency in travel time and an environmental sustainability in the green agenda. So important to start thinking of that as we move towards net zero. Population health, really important. Think about the big picture. Is there anything that our intervention is going to show us that we're moving towards what we want to achieve in terms of population health? These are some of the long-lasting changes, and you might not see those immediately, but I think really important to be thinking about all your hard work and how you will be able to evidence that you've made a change in your local population. Clinical outcomes, clearly massively important to us as a profession. We do know that increasing diversity and inclusion has an impact on how we deliver services and the outcomes that we get. So what will be your measures? I want you to think about all of those domains, but I don't want you to overburden yourself with a huge weight of governance of measurement. So sometimes really simple ways of measuring things that you're already measuring, so you're not adding an extra burden, but just taking some time to think about that at the beginning. Thank you. And then the really important part, what is it that works? How will you understand that? So we think about this in terms of outcome measures, process measures, and balancing measures. So I'm just going to touch on these really, really briefly. The outcome measures are the impacts on your patients, perhaps on your staff overall. They're the things that you're really trying to achieve. In order to achieve those, you're going to change some of your processes. Process measures always come before outcome measures. So always think about, what is your measurement? Is this process or is this outcome? And you'll need to have a range of those because you'll want to know that your process is starting to become more reliable, and that's going to start pushing on the success that you see in your outcomes. The other thing I want to just touch on now is your balancing measures. And this is where your naysayers are of real value to you. The people who wear the black hat, who always say, yeah, but you can't do that because, or that won't work because. Listen to those voices, because they're all the risks of making your change. And you might want to think about some of those voices as being your helpful friends for your balancing measures. So if we think about, if we give everybody a gold standard service, the unintended consequence of that is our waiting list might grow 6 months. That will be a balancing measure. It's not something that you want to achieve, and it's something that you want to keep an eye on, because you're going to have to balance some of your unintended consequences. There are always unintended consequences when we're making a change. The thing is to know what they are, to be measuring them, to keep an eye on them, and to use them as our red flags, to be thinking through, are we making the right change, and are there any tweaks that we can make? Thank you. So when you've made your change, how are you going to share what you've done? So we know that there are pockets of brilliance right across the profession. People who get on and do things that they think are just ordinary and just everyday occurrences to them, but actually they're quite different to other places down the road or at the other end of the country. So how are you going to share what you've achieved, and how can you use your networks within the profession to be able to do that? We tend to share what we've achieved as being successful, and we tend to bury the stuff that didn't work under a carpet. But I would really challenge you to think differently about that, because there's so much we can learn about what doesn't work. We don't see those as failures, we see them as learnings. Sometimes what we anticipate is going to work isn't the reality. So have a think about being really brave and sharing the stuff that didn't work for other people's benefits, as well as clearly the things that did work. And, you know, you will never be able to lift and drop what somebody else did, because your world is different. Your culture is different. Your services are different. They'll be commissioned differently. You'll have different numbers. There will be a huge range of differences. But what I would ask you to do is think in a positive way, an appreciative inquiry. Which bits of what they did over there could we have, and adapt and use them within our context? Rather than, I think what we tend to do often is say that won't work here. They're not like us. We're different. Well, I would argue there is more that joins us than separates us, if we can look with that appreciative eye and being really curious about what bits we can take into our own contexts. Thank you. So that's the end of my presentation there. So to recap, what's the problem you're trying to address here? What's your baseline? What does it look like when you analyse that? What's your ambition? Be really clear what you're trying to achieve, how much and by when. What are the things that you might do to take you on that journey to making some achievements? How bold do you want to be, and in what sequence do you want to do those things? Which options are you going to pursue? How are you going to measure what you're doing so that you don't have that awful thing that you become wedded to the change and it's not the change that's going to make the difference? So you have to be prepared to put down your hobby horse if you show it's not working. And then how are you going to measure all of that so that you can share, spread your excellence, and let others have the benefit of your wisdom of what did work and what didn't work? There's a whole host of resources. Each of those things could be a whole day's training on its own. So this has been a whistle-stop tour, hopefully useful. The link that you can see on the slide now, you'll find a raft of resources. And I would encourage you also to link with your quality improvement teams in your own trusts. Many of you, most of you probably will have those teams, and they will be really helpful to you to lend some coaching, some expertise, and give you some top tips as you work through your changes. So that's the end of my slide. I want to wish you all the best and really great luck. This is such an important agenda. And I know all of you watching this have got a real ambition to make a difference to ourselves, to our profession, but ultimately to the people that we serve, our patients and populations. Happy to engage with anybody if you want to speak to me further, but good luck with your endeavours, and thank you for listening.